What we realised is that obviously we're an integrating organisation. So we are at the cusp of secondary care, primary care, social care, voluntary sector. We're everywhere. We're everybody's interest, and sometimes we're nobody's interest at all. So actually we're well versed in creative solutions and partnerships. We're involved in joint venture partnerships. We have secondments. So in our proactive care team, where we are the prime provider, we're the provider of services, we have a whole load of multidisciplinary, multi-agency staff members, social care workers, mental health workers. We have primary care. We have a pharmacist, and I'm going to just touch on that in a second. So we're very used to and well versed in finding different ways, innovative ways, to make things work and not get too hung up about the organisational form that we're working. And one of the things that's very important in achieving this is to make sure that you don't really focus on the organisational dialogue, because the organisation itself will get transfixed with what form you need. Again, it comes down to letting the front line manage it and to start having professional dialogues. And I'd include in that the pharmacy dialogue as well. So the important thing we discovered was to make sure that we were system-centric. So we took account of everybody else's place in the system. We didn't just think about the impact on community services. We thought through, if you take a longitudinal view, we thought through the implications for other members along the care pathway. And we started to think person-centred. And we shaped our multidisciplinary team around the person. So, here's some examples, these are real. We have what was called a proactive care team, which is focused on anticipating and preventing deterioration. As I've mentioned, we're multidisciplinary, multi-agency, but importantly, we're a single team. So there's no organisational boundary to it. Very much everybody works together and is seen as a single team. The pharmacist involvement in proactive care, they weren't the first. Of course, if it had been my way, then it'd definitely been the first, but they weren't the first, and they weren't the last either. And this comes to letting go and letting the frontline clinicians really do the change to bring it about, to make it happen. Because it came about very, very quickly that you absolutely needed a pharmacist. If you were going to do anything about any part or point of care, then there was pharmacy and medicines related issues at the heart of it. And now we have several different methods of managing our pharmacy resource, because like most NHS resource at the moment, it's in short supply. And when you're on the south coast and you've got the South Downs behind you and the sea in front of you, you're very limited to where you're going to get your resource at all. So what we're doing is we're employing our own pharmacists where we've got them. We're accessing community pharmacy, and I think it's an interesting point, of course. What we haven't done is try to talk to a single body of community pharmacy. What we've done is worked around the general practice community and gone to the individual pharmacies and found where we need them, were they interested. And we've also worked with the commissioning team, because actually this job, the job around medicines management in proactive care, is the job of everybody, and also the job of a single person. The other example around, which is not dissimilar, is our integration with secondary care. So one of our major hospitals has come together in what we call one call, one team. It's our reactive care model. It covers A&E, emergency admissions, and into the community, so our rapid response and our discharge teams as well. We have a joint venture with a hospital that's involved. It hasn't been without its pain working that through, but we are getting there because we're committed to making this change happen, and we know we've got to. We have a pharmacist who's part of the team in the joint venture, and they operate in both spheres. And actually what they've found is that they've really found it very exciting. So when I was asked about where's the pharmacist's place in transformation, I think they're in the multidisciplinary team working around the people. They absolutely belong there. You're part of the multidisciplinary team. They're at every stage of the integrated pathway. And they're doing what nobody else can, which is supporting drug management. And they're also sharing the skills that other people can apply. So we have a principle as part of our team that you have to be prepared to share your skills. If you share your skills, you can cut down on the number of people who have contact with the patient. And together then, you're working to support the patient rather than how organisationally and professionally supporting yourselves.